Hi there. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. I'm Jamie Taylor. I'm going to be your host today, and we have great guests on this program that talk about healthcare issues relevant to you or your family members. I hope you'll stay tuned after these messages because I've got a really exciting guest for the program today. We'll be right back. Welcome back to Your Health Matters. My guest today is Dr. Haven Malish. He's one of the newest doctors here at Kingman Regional. Thanks for being on the show.
My pleasure.
So your specialty, I know you're a pulmonologist, but what's your specialty? What does that mean?
Well, it's your specialized area training, and I have several that all have to do with airway disorders.
So
and
breathing.
Exactly.
Okay.
And so let's start top to bottom. Top up here, you have a lot of issues with sleep apnea, and so that's where my sleep specialty comes in.
Okay.
I deal with other sleep issues besides sleep apnea.
Oh, what other kind of sleep issues are there? So
Well,
don't mean to
there's
get you sidetracked, but I didn't even know there were others.
I'm going to finish your question
Okay.
first. Down here in the airways, that's more of the pulmonologist field, which is airways and lungs. And then if you're really sick, like with a bad pneumonia and even things deeper further down in the chest, you could end up in the ICU, which is critical care medicine, and that's the three specialties I deal with.
So all three of those.
Yeah, and so back to your other question,
sleep, yes.
starting here.
Okay.
So with the sleep disorders, the most common one's insomnia, and I think everyone's experienced that at some point.
Right.
And the second most common is sleep apnea, which we can get into that a little later. Yeah. And then the others that we deal with commonly are restless leg syndrome.
Oh, okay.
Sleepwalking. There's some less common ones like REM behavior disorder, which is a parasomnia, which sounds like something out of a movie.
Yeah, I was going to say, is that like from the Psycho or something?
Yeah, but it's a true medical diagnosis, and there is therapy for it. So
is that caused when people don't get REM sleep? When you said REM, did I hear REM in that?
Well, REM behavior disorder, they're getting REM sleep, but during normal REM stands for rapid eye movement, and there was a band in the 80s called REM, which is kind of where people commonly had heard of it. But during REM sleep, you have rapid eye movements, and there's really two areas that are not inactive like the rest of your body during REM sleep. So for example, if you're dreaming in REM sleep, if you're running, there's a disconnect on your body actually running.
Oh, so it kind of stops you from physically doing it.
But in people with REM behavior disorder, that is not always the case. And so you might see them act out their dreams, for example.
Okay, so they're kicking the covers.
Yeah, yes, exactly. And so again, there's medication for it and ways to deal with it behaviorally that do not include medications necessarily. So
are you relearning or something?
Well, just make the door to where you can't get out at night.
Oh, yes, okay.
Just for safety purposes, or if you tend to get out of bed with this disorder, and some patients just don't want to take any medication for it.
Some people don't.
Pad the furniture so that you don't hurt yourself.
Running
if you run into it, things like that.
I've never thought of that.
Yeah, but it's not as common, but it does happen. So there's a whole broad spectrum of sleep disorders we deal with.
Interesting. Hadn't even ever thought of all those. I mean, it's because as we talked before the show, my own personal experience with sleep disorders is using the CPAS and
CPAP.
CPAP. Yep. I always say CPAS. I don't know why. I just think because it passes through my, I don't know. But it's CPAP, right?
Yeah, it's positive airway pressure.
Pressure. Okay, so it's pushing the air down and so. If someone has that type of a sleeping disorder, it's usually something stopping their breathing.
Well, yeah, you're back to the sleep apnea now.
Right.
So sleep apnea is apnea. The definition of apnea is that the airflow quits in whatever mode or fashion, which I'll get into.
Okay.
So apnea is stop in the airflow.
Okay.
Obstructive sleep apnea is one type, and that's where the airflow stops because of an obstruction. So if you think of a flimsy rubber tube, and the tube gets really flimsy so that it collapses,
Okay.
the air can't get through because there's a blockage or an obstruction.
Right.
And so that's the basic explanation of how obstructive sleep apnea works. And so that can, if we're talking about us, rather than being rubber tubes,
Right. It's your
it can happen
breathing
actually.
passages.
It can, and that can happen at several different levels. There's about 5 different anatomical levels, and nasal passages, your tonsils, the tongue, and then even deeper down. Which is why we know now, whereas 10, 15 years ago, a lot of times surgery isn't the first step. A lot of people went and got surgery, and we see them after the fact, and they're, while there are many cases that get the appropriate evaluation by a specialist in like an ear, nose, throat specialty, sometimes they can cure them, but a lot of times it's not the case, because even though if you take care of large tonsils or a low-lying soft palate in the back, there's still the other areas that it can possibly happen with. And so
you might get one area fixed, but then the other one's going to...
Right. So in general, the first line treatment would be some sort of positive airway pressure, or as is commonly known, these CPAP machines.
Right.
So there's other fancier versions, but just for simplicity's sake, we'll call it CPAP.
Okay. Well, and that what works for me, as we talked again before the show, that I'm a great proponent of how wonderful CPAPs are, and my husband is probably even more. He's the first one to tell everyone how much better I sleep and he sleeps because of that. So people shouldn't be afraid.
Yeah, that is a very common, that the bed partner is just as happy as the patient. And especially if it's severe, you're going to notice right away. And that's one of the things I like about this area. You can see a dramatic difference over a short period of time.
Yep, absolutely.
And it's almost as dramatic as someone getting surgery.
It's that quick of a fix.
Right.
Yeah.
So everyone has different responses to it. And there, some people, you can see things improve dramatically on paper, but then the patient still doesn't get that perception, but more commonly it's the opposite.
Yeah.
That they do get a good effect, and there's plenty of patients that don't think they're going to like it, and they end up liking it.
Well, I know we've had Mark on the show from the sleep lab, and Jimmy, who helps with the fittings of the different equipment and things, and we've talked about how a lot of times I think people are, they just imagine, oh, I can't sleep with something on my face. But once you get used to it, and there's different kinds, that's where Jimmy and Mark come in handy too, to fit you for the right mask on your face.
Right.
It's each person's different.
Yeah, so that's exactly right. There's different types of masks, just like there's different types of these CPAP blower unit machines. And I mentioned this earlier, they're like cars. There's a lot of patients out there, they tried it 10 years ago, and as they get older, they have that thought, maybe I should try it again. It's really come a long way in the last 10 years in terms of the comfort of the masks, the variety of the masks,
and the size of the machine.
The size of the machines,
gotten smaller, easier.
How quiet the machines are, and actually the ways you can sort of fine tune or tweak the machine to make it comfortable for you.
Right.
So the machines are smarter, more efficient, quieter. some are sexier looking.
Yeah.
One of them looks almost like just a CD player with an alarm clock now.
Oh, I haven't seen that one. That's
yeah.
kind of cool.
So they come out with new ones all the time, and it's just like a car.
Always
they get better and
improving.
better.
Sure.
Yeah,
Makes sense.
and actually the price has come down too.
Well, it's again like a car or a TV.
Right, technology.
Right, as more and more people are using them, or it becomes more commonplace, they get less expensive.
Exactly. So, so there's a lot we know now in terms of sleep apnea and the ways we can get people used to the CPAP as compared to 10, 20 years ago. It's almost seems like it was in the dark ages.
Right.
You know, in the
well,
1990s.
I don't know that people always realized how important sleep is and how much it impacts your total overall health, right? And all the other side effects that go along with it.
That is a very good point. And so people with what you're talking about is anyone who has either sleep deprivation or the equivalent of sleep deprivation. In other words, you might be sleeping the normal amount, which is 7 or 8 hours a day, or even more than that.
Right.
But if it's not a good quality sleep, it's the same as being sleep deprived.
Okay.
And that could be due to a primary sleep disorder like sleep apnea, restless leg syndrome, which we'll stick with those two because they're the most common. That's the same as being sleep deprived.
Okay.
And when you're sleep deprived, you have a number of different physiologic effects. Your mood changes.
I know I get crabby if I don't get enough sleep.
Yeah, and one of the surprising things that just kind of your moral compass changes. Did not know that until I did some studying in it, which is why there's a focus now, especially people in professional industries, where they really are focusing on restricting work hours, the pilots, residency training, and so forth, because of how important this is.
Interesting.
And so some of the other the things you probably heard of is that it can raise your blood pressure.
Right, blood pressure, even diabetes, or your weight.
Your weight.
I've heard.
So your hormones change. The amount of the hormone that suppresses appetite, you lose that, and the amount of the hormone that drives your hunger increases. So that combo, when you're sleep deprived, it makes you tend to gain weight.
Because you're going to eat more.
Right. In terms of the diabetes, your insulin resistance.
Right.
Definitely is adversely affected. And so it can push you down that path towards diabetes aside from any weight gain.
Right.
So it really changes your whole endocrine or hormone physiology. And a lot of people don't realize that.
Right, and we just kind of take sleep for granted, I think, a lot of times. And especially when we're younger, you just figure you can burn the candle, right?
Yep, right. I've done that before.
Yes, well, that's part of being a doctor and going through all that training and stuff, too. You've had to do that.
It's definitely, it's been very interesting from the medical training side as more and more information is discovered about sleep. You're amidst, during my training, a lot of sleep deprivation.
Right.
It's part of the package of going to school and becoming a doctor, and yet we know the adverse effects of it.
Wow.
And so there's this tug of war that was going on as I was going through training of how many hours of work is appropriate in a week. You'd have the old school guys saying, well, in my day, and so forth.
Back in that day.
Yeah, and
well, we're going to take a real quick break, and then we can come back, and that'll be a good chance to talk about your education too.
Okay.
So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Malish, one of our newest physicians here at KRMC. Thanks again for being on the program.
Again, my pleasure.
So we were talking before the break about the importance of sleep and how that kind of, especially when you're a resident in training and going through that whole education, sleep's like not something you get on a regular basis. So, but then I wanted to talk about education because I saw briefly in your bio you did some time in Hawaii. Is that where you started your medical education?
Let's start from square one.
Okay, good.
Well, I grew up in Texas.
Oh, okay.
And, right around 9th grade, you know, my dad did a switch from real estate to what his degree was in, accounting. He's a CPA. And, you know, it looked to be a good career move to go to Hawaii. Not a bad choice,
I was going to say, people would be like, wow, shucks, I don't know.
Yeah, right, exactly. So he moved there when I was in 9th grade, and he's still there.
Oh, he is? Okay,
so,
very good.
So that's what got me to Hawaii. I did high school there. And then after that, went to the East Coast for my pre-med training at University of Pennsylvania.
Oh, okay.
And then back to Hawaii. Kept the in-state status for Hawaii.
Very good.
Then after that, I went to LA County, USC, University of Southern California, and did residency training in internal medicine. 3 years. I took a year off and was a hospitalist for a year.
Oh, okay. Very good.
And then did 3 years of fellowship in pulmonary, which is lungs, and critical care medicine, also at USC.
Okay.
And then I did my last portion of training up at Mayo Clinic in Rochester, Minnesota for sleep disorders.
Okay, wonderful. And then you came here to Kingman from there? Or
well, there was, I had some time after training where I did some traveling as a locum tenens provider.
Oh, okay.
And that's basically, a lot of people give you a funny look
when you
say that, but then traveling nurses, they say, oh, okay, well, it's like a traveling doctor.
Sure. Yeah, you fill in kind of in spots where they're...
Right, and the literal translation of locum tenens is to fill a need.
Oh, makes sense.
Had some interesting travels, Virginia, all that was East Coast, West Coast, all the way to Alaska.
Oh my!
And so just before Kingman, I was living in Rochester, Minnesota still.
Okay.
And also working through Mayo Health System Mankato Clinic.
Oh, okay.
And that's in Mankato, about as you know, about an hour and a half
south of Minneapolis.
Yeah, it's east of Rochester, south. West of Minneapolis.
Yeah. Almost due south on 35W.
Right, it's a triangle. Yeah. So that's, you know, so I was kind of dabbling.
Kind of figuring out where you wanted to settle?
And also, you know, it gave me some time to give the interview process the time it deserves.
Sure.
A lot of physicians, they'll have, you know, wife, kids, family, and say,
well, right away.
My wife's not going to move. I got to live here.
Right.
So, you know, there's 3 hospitals to choose from, and they pick. Well, I did kind of a national search, and
that's smart.
yeah, and so.
And we got blessed to get you here.
I am glad to be here. I did a lot of interviews, and Kingman KRMC kept coming up on top of the list. So it's really about the best fit for the institution and the doc. So
absolutely. Well, and you're part of a great team. You've got Dr. Matheny and Dr. Wynn that you're working with, and they're both awesome. I mean, I've been seeing them as a patient, but as a co-worker and that too over the years. So
they're a great group to join.
Right, absolutely, and very busy we are. We keep them very busy in Kingman. So
it's a good busy.
It is, yeah, absolutely.
Yeah.
But I think, and then your specialty with the sleep lab, of course, partners well.
Absolutely.
With that.
Yeah, we all have our kind of things that are our niche within pulmonary, and mine is the sleep disorders.
Okay.
So, you know, we all kind of add to the group and synergize like that. So
that's awesome.
There's a lot of good positive energy with those guys.
That's super.
So,
and you just moved to your new offices. You're up in Suite 203 now
that's
on
correct.
the 2nd floor.
That's correct.
So a lot of people may not know that, even if they were seeing Dr. Matheny or Dr. Wynn in the past. They were on the 1st floor.
Yep.
Now they have to take, we were joking, I don't know if you heard this joke, but when they were being moved up to the second floor, we were asking them if that was part of their therapy for their patients. They had to start using the stairs. Dr. Mancini got a little nervous there. Like, just kidding, just kidding.
There is an elevator.
Yeah, we really do have an elevator for them. But it's a beautiful new office. I just got up there the other day, and it's really nice.
Yeah, it is. It is. I like it.
Good. That's great. Well, we're, like I said, we're blessed to have you here. It's wonderful to have you as a new addition to our team, and so
absolutely, I feel like I fit right in.
Yeah, that's what I've heard too. So that's good. So you're getting settled into Kingman, and we were talking before the show. You've kind of been exploring the area, and been up to the Wallapies or done any of that kind of stuff yet?
Up the mountain on a half-day excursion.
Okay.
So
what kind of things do you like to do for fun outside of work?
Usually anything involving water, which makes it challenging.
Well, yes,
but there is Lake Havasu.
That's true.
And I've probably avoid the weekends that are overly busy there, but you can forget that you're in the middle of Arizona.
In the middle of the desert, I know.
I rented a boat, and it was it was nice.
Yes, yeah.
So
there's some fun areas like Pirates Cove. I don't know if you've been there yet.
Heard of it.
Yeah.
I don't think I went there, but
yeah, it's north of Havasu, up in that area.
I do scuba dive.
Oh, good.
Most
you
of
couldn't live in Hawaii. I'm registered myself, so I know. And then we're only 5 hours from San Diego, but that ocean is very different from Hawaii.
It absolutely is.
My first time when I was
cold.
Actually, yes, it is. When my husband was in the Navy, and we transferred from Hawaii to San Diego. And the first time, I was like, oh my gosh, I haven't been in the ocean in like 10 days when we moved there. Right? So I'm running to the ocean, and my feet hit that water, and I was like, oh my gosh, how can this be the Pacific Ocean? It's so different.
You need a wetsuit.
I know, and you get very spoiled in Hawaii. You can just throw your tanks on and walk right in, and you don't do that in San Diego.
I lived in the Los Angeles area.
Okay. So
I think I can count on one hand the times I actually went in the water there over an 8-year period.
Yeah, we were in San Diego for 11, and it was the same thing. It's just like, it's not the same. You get spoiled. Now, did you surf? I was thinking high school.
I wouldn't call myself a surfer. I did some paddling.
Okay.
I carried that over when I was in college. I was on the crew team.
Oh, good.
That was the closest thing they had.
Yeah.
And then in Hawaii, that's where I picked up scuba diving.
Yes,
I think I was fourth-year medical student.
Oh, very good.
You have a little more time.
Yes. But then you might get some sleep now.
Exactly. So.
Well, it's interesting. I just thought of this when you're scuba diving, and of course oxygen is a very important part of scuba diving, and here you are doing pulmonology and learning about lungs, and
they are related.
They are. Huh?
They are related.
Very cool. Very good. Well, I know people always tease my husband because they'll go, Hawaii, Kingman. How did you end up in Kingman? And we're like, I love Kingman.
Yeah, it's not. I like it.
Yeah.
I think there's people coming up to me and asking, do you like Kingman? Are you sure you're going to stay? No, I like it here.
Good.
There's plenty to do in the free time. There's plenty other places that are just within striking distance.
Yes. Yeah. So you can get to those places very easy and still have that hometown feel where people are going to get to know you.
Yeah.
They're going to come up to you at Safeway or at Walmart and go, hey, Dr. Malish, how you doing? And you'll be like, oh, hi. Well, thank you so much for being on the show today. We're very blessed to have you here. I hope you'll stay tuned next week. I'll have another exciting guest for you. We'll see you then.